everyone. Guess what? It's not midnight. It's more, well, it's not even noon, but gotta have some change. And I'm a little windy. I am outside. I hope my microphone's okay and everything, but you gotta try something different. I'm very excited. I have two midnight connections today. One is I'm sitting by the water. You can't tell, but it is beautiful. And for those of you who know me, some of you will know my guests because they see my guest here and there pop on my show a lot. So I like to bring on amazing people. And I think something that's really important, we're going to talk about mentors and leaderships. And it's really important as a woman supporting women, but this goes for men too. But I'm just saying all of this is very important. So everyone says I do so much. This woman has me beat. She does more than me. So without further ado, I am going to bring on Dr. Michelle Parsons.
Hi,
hey.
Christine. Hello.
How are you?
Doing well.
Good. Well, I first want to just give some accolades about you, just so, because a lot of people might not be familiar with you. And excuse me for there's so much, but I apologize for being so much. But when we dive deep into this, you're going to see why Michelle is so amazing. She's a highly skilled medical professional with a diverse background that uniquely shapes her approach to patient care. Drawing on her experience in emergency medicine and trauma surgery, she brings a wealth of knowledge and expertise to her practice. As the combat veteran and former flight surgeon in the USAF, Dr. Parsons thrived in the demanding and high-pressure environments, honing her abilities to provide exceptional care to each patient. Proud graduate of Jefferson Medical College in Philadelphia, Dr. Parsons completed her internships in general surgery at the State University of New York. Following this, she pursued her residency in emergency medicine at Christiana Hospital in Newark, Delaware. Dr. Parsons offers effective and affordable cosmetic and wellness treatments for both men and women, aiming to help them to look and feel their best. And then she has, with additional training in laser cosmetic procedures, women's health in women's health, Dr. Parsons has become a distinguished figure in the field of aesthetic medicine. She was featured as top doctor in Delaware's Women's Journal in 2012. She's board certified in emergency medicine with specialized training in surgery and aesthetic medicine, extensive experience in advanced Botox and filler techniques. And I'm going to stop there. I could keep going on and on. So I'm reading so much, but I think it's really important to know your credentials before we go on, because you have an amazing life. And I also want to tell everyone, if I sound weird, I had COVID last week, but and my son just graduated from high school. But all of these things shape who we are, and so like that incredible history has shaped you, and that's what I want to go into. So I want to kind of talk about mentor and leadership. So I'm going to start there. Do you consider yourself a mentor?
Well, first of all, thank you for the very nice introduction. That was very nice of you. And I love your topic of mentoring. And I haven't really thought of myself as a mentor, but I think just by living our best lives is when we become mentors. So it doesn't have to be something necessary that you decide you're going to do. I think it's just being who you are, and people will look around and they might notice things, any different facet that it might be that you're doing that resonates with them and what they would like to accomplish. So I think for everybody, that would be the best way that we can all be mentors.
That is so true. And the reason I bring up the topic of mentorship is because you're very involved in the community, and you are involved with the 38th district, and you are an RDC, and which is a representative district chair. Some people are going to be like, what is an RDC? So one, can you give a little background on what the 38th district is? And what made you take a leadership role in that?
Sure, sure, absolutely. So, here in Delaware, and probably most states, states are divided into representative districts, and we all have a representative who represents us. And I had never really been involved in politics in any way up until just a few years ago. And just kind of, it was actually, well, I should go back a little bit. It was actually my son who became a little interested in it, and in the path of like pointing him in that direction, I became involved as well. And again, it was just something, hey, I want to do something, I want to help out, contribute, learn more is really how it starts. I would say curiosity, and then just doing a little bit. And then when you find that you do something, you just do a little bit more. So got involved with my local area, which is near Bethany Beach, Delaware, and inland, so Fenwick Island and Ocean View, Rehoboth, Stephenville, Frankfort, those areas in Delaware, which is most southern tip of Delaware. And just kind of like started out as a volunteer, and became a precinct captain. So it's a smaller area, and that might be like a town or a couple of neighborhoods. And again, just helping people like you understand where your polling place is, where, how to vote, where are the issues. And then it just went from there, became a level above that, where I became the representative district coordinator and have like 14 precinct captains within that RD. And it's just something where we meet regularly, and like-minded folks, and how do we let people know about important issues happening in our town? It's not always about elections or how to vote. It could be, there are offshore wind turbines coming in our area, and are we represented in that? Or other topics. And of course, there are elections, from the most local school board elections. We'll have something like meet the candidates or help the candidates. And then, of course, all the way up to all the elections, from our state representatives to governor to, of course, president and other elected officials. So that's what I started doing.
Well, and that was one of my other topics. I know you're very involved in the wind farms. Do you feel like that is just the current issue that you're dealing the most with, or do you have other ones as well? And this audience is a lot of Delawareans, and then even Marylanders who visit our beaches and everything. So I didn't know if you want to comment on specific causes, maybe the wind farms, and also other ones that you feel that affect your community.
Yeah, you're absolutely right. We consider it a local issue because it's literally in our backyard. Bethany Beach is in our district, but you're absolutely right. It affects the entire nation, because if anybody wants to visit the ocean, our seaside, the coastline, right now, our government is looking at selling off our natural resources, our coastline essentially, and using it for offshore wind turbines. And that absolutely affects every American, whether you want to visit the beach or not. It affects the security of our coast. It affects the marine life, wildlife, especially dolphins, whales, things like that. So it's definitely an issue, but it's definitely one in our local area that we have definitely taken notice of, because we see it every day. It's literally in our neighborhood, our backyard. So that's a big issue for us. But as far as Delaware is concerned, there's other issues like, basically the state of our economy in Delaware. We just found out that Delaware's gross domestic product GDP has actually shrunk by 1.2% since last year. The only state in the nation that our economy is actually shrinking, and that was alarming. So we need to look at what's going on in our state, and often it's a result of education. Well, Delaware, even though we spend at the top, I guess, amount of money per student, one of the highest in the nation, our performance of our students is one of the lowest. We spend in the top 5% and our performance in the lowest 5%. So that absolutely impacts our state economy. If we have graduates who can't find productive work, or if they leave the state, or they just can't find high paying jobs because of a lack of good, solid education, and that's going to affect the entire state, not just the people graduating. So that's been a hot topic for us as well. And like I said, affects everyone in Delaware.
So it's clear that you are, involved and engaged in civic duties, but how do you encourage others people, if they're like, and one, I can answer this too personally. I always give a little bit of my opinion. So Michelle has influenced me. I know one of the things she's going to say is start going to the meetings. I mean, there's like a whole vocabulary out there that, you literally, I'm an educated person, and then you just feel dumb, and it's like a whole world is opening up, and it's very easy to go through this world with blinders on and just have no idea like what is going on or how it affects you. I mean, I realize that this education thing has affected, even though he's graduating from high school and honors and everything and going to college, some things have affected him, and I am now seeing the ramifications of stuff. But if I never got involved, I would have never even seen it. So I guess my question is, like, let's just say there's other people that aren't, or like, I don't know what's going on. Like, that's literally what I was like, I don't know. Like, but I want to get involved. Like all of a sudden, it's very easy for us to complain. And I feel like we are a society of complainers. And it's very easy for us just to hit on social media, but it's a very big difference to actually get involved. So, since you are an RDC, how are you encouraging people that anyone can make a difference and anyone can get involved?
You're absolutely right. Anyone can make a difference. And so far, like it's just seeing you really blossom as well into getting so involved. And that was a big change. We started talking about it. So that's been awesome to see. I would say a lot of people, one, they don't think about it much. They don't think about who is deciding, what our society is like. But these are just regular people who live here in our state. We know them, we meet them. And they're the ones who get elected to be our representatives. And they're the ones pushing bills, creating bills, passing them, passing our laws. So I would say most people are out and about, we're living our lives. We're going to school, we're going to work, we're raising our families, we're going on vacations. We don't want to be bothered with that. But I think we finally reached the point where people are noticing, oh my gosh, gas prices are through the roof. My groceries are getting higher and higher. Lots of different things are concerning people. And the first step is curiosity. Ask questions, do your research. And I love the people who yell at the TV because they're already very interested. They just need an outlet for that. They think sometimes they're alone. They're alone in their living room. Maybe their spouse is telling them, pipe down. So they feel like maybe that's the reality. But there's a lot of people who feel exactly like they do, like you do. So, start asking questions. And we're really fortunate in our area, 38th District, that we do have a very, very vibrant group of people, a club. So we have the 38th District Republican Club that meets once a month, the fourth Monday of the month. And we have like 50 to 100 people, depending on the month, who will come. And we talk about these issues, but not only so. One is just be informed. Well, what's going on? What are we passing now? And then it's, well, what do we do about it? Who do we contact? Where do we go? Who do we email? What meeting do we need to go to? And it's been great to see this process with so many people. So I would start with that. And if you live somewhere else, then you find out, just who's your representative, what are where, and they usually do meet. They usually have like a coffee once a month, start with that. And that was actually how I started. There was a meeting at the library, Bethany Beach Library. I went to that several years ago. It was about offshore wind turbines even back then. And now I'm the president of the club. Don't even know how that happened. But I guess, if you're willing to get involved, people are willing to put you to work.
Well, I want to shift gears a little bit and talk about also the passion you have for your job. And, thank you for your service and everything. We just had Memorial Weekend. And, but, that sounds like some pretty scary stuff. I read it. Anyway, what led you from the military and because you were involved with medical stuff there too, to what you're doing as a medical spa doctor. I mean, like that's a huge shift. So I don't think many people
Um,
hear your history or your journey of, how do you go from flying planes to working at a spa?
yeah, completely different. So I feel like I've had a couple different careers, and it started out with, me wanting, always wanted to be a doctor, and I joined the military as a way to pay for my education, not having any idea just how amazing, how much fun, and how much I would enjoy being in the military, being in the Air Force. So I came out as a physician, but not a really trained one. When I went into the Air Force, I was what's called a general medical officer, which is family practice. And back in the 90s, we truly did do family practice. We took care of elderly patients, children, families. You don't see that so much anymore. But I was very fortunate to go overseas as well. And again, it was just started with curiosity. I saw this course in the military, aerospace medicine, and so we're allowed to take courses in the military. And I signed up for that. And I went away for the course, which was a 3-month training. I didn't know that at the time either. And then when I came back, I had a new job assignment. So I didn't even know that was going to happen. So I was assigned to a flying unit. And wherever they went, I would go with them. I would pack my bags, a medical kit, a little box of my supplies, get there a few days before the flying unit, set up a clinic. And sure enough, there's always illnesses and injuries wherever you go. But meanwhile, I'm practicing medicine overseas, either in a tent, a hotel room, or anything. And and how I got into flying was taking that aerospace medicine course. They needed someone assigned to an F-16 test center. So I was the physician assigned to test pilots, and I would fly with them while they're doing their test flights and either recording data, filming data. So again, just outside my wheelhouse, but it was incredible. And then that led to my next assignment being assigned to another fighter squadron, F-15 fighter squadron in Okinawa, and somehow found my way in numerous, I guess, conflicts, wars, either in Bosnia or Kuwait, through my various roles as a flight surgeon. And it was amazing. I probably would have done that the rest of my life, but I needed to complete my medical training. So I did leave the military to go back to complete my civilian medical training. But otherwise, I would have stayed.
Well, I think that the reason I bring up all this military stuff is we're talking about mentorship and leadership, and I think that instilled a lot of leadership into you and everything, and then it also shows how much you care. So, like a lot of med spas, I find it a very vain business, vanity, get your lips done and this done, and just trying to be younger and everything. And that is something you never really focus on, which is what I like. I mean, this is I love the holidays. It's National Acne Month and everything coming up in June, but you really transform people. You tell them to reclaim their life. You are talking about self-confidence. You have this bareness thing. I mean, we can talk about, but just all these things in these words are not about, here's the fountain of youth. And, you definitely come from it from a very caring, perspective. So one of my questions is can you share a success story, a highlight, but just like the kind of transformative impact? We're clearly making an impact in our communities and everything, but I really think you do make an impact with your patients. So you don't have to mention any names or anything, but you do weight loss. There's I've gone through my own journey of weight loss. Like that just totally changes. It also changes your mindset, and I really feel like you address women's mindset, and it's not all about needles and injections.
Yes,
So can
thank
you
you.
share a transformative story?
Yeah, so I think you're absolutely right. My vision when I was, much younger was to have a very family practice, very family oriented practice. The first physician I went to when I was a kid, was in his house. His living room was the waiting room. The kitchen was the reception office, and that always stuck with me. That was something that I would like to have. And lo and behold, my office is in a house, an old house, and the living room is the waiting room. And so our approach to folks, and so we do a lot of different things. I know it's called a medical spa, and you mentioned how many cosmetic treatments we do, but it's truly like we have sick call, we see sick patients, and it could be anything, upper respiratory infections, anything. And so we diagnose things every single day, and it could be like literally a mother coming in with Botox and says, "Can you take a look at my son's stomach?" And we'll diagnose appendicitis, right there. And only because that's what I'm trained to do. And or someone will bring their boyfriend in. Hey, he's having, and these are things that just happened like this past week. Like he is having urinary symptoms. Well, we have cups. Oh my gosh, you're passing a kidney stone. And so we can set up treatments for these people, and I coordinate their care with emergency departments, having a relationship with the nearby hospitals. I'll talk to the ER doctors. This is what we found. This is what I think you should do. Follow up, let me know how it goes. So we do a lot of that. People walk in all the time. And it is very holistic. We talk to people. One, I love that we get to know our patients so well. Um, Not only do I know them, but I usually know their mom, their daughter, their son, their sisters, their neighbors, and I have definitely built relationships with them over years. Some of my patients I have known 18 years. And like I said, I know their whole family. So I knew them when their daughter was 5 years old, and now they're entering medical school. And, and I have them mentor in our office too. When they were younger, they could spend time with us. And I've done that for a couple of people, a couple of our patients who've gone on to medical school. So just a lot of different things. And of course we do. So see a lot of patients who have had chemotherapy. So we'll do vitamin testing. Like, what are you depleted in since your chemotherapy? If they come in maybe for skincare, but like we cannot really hope to address that until we heal your nutrition, the other things, your inner beauty. And so we address that. We look at hormones, and if you're on our weight loss program, we're going to look at lab work, thyroid labs, your adrenal glands, and just lots of different things. And so our our skincare is really just part of that. And yes, we can restore things that have changed over time. It might be, you know, um, nasolabial folds or cheeks or lip volume or hair restoration, but it's all combined together. It's not just pushing cosmetic treatments exclusively. So that's why I think it's been enjoyable and interesting to continue doing this for as long as I have.
And I think it's important to note that it's scary. I have to say, and full transparency, you're also a client of mine and everything, so I've learned a lot about your business. It's scary how there are people doing these procedures that are not doctors, and you could get. I like the fact that you're saying all this other stuff that you address, but it's also scary on the cosmetic side where people are getting injected by non-doctors. Like, this is that if you don't know what you're doing, really bad things can happen.
Yeah, there's a reason I feel that these procedures are medical and traditionally have been only allowed by physicians, medically trained physicians. So for me to go ahead and easily be able to do a dermal filler or injections, well, one, I was trained as a surgeon for a couple of years. I worked in the emergency medicine, very dominant in procedure-driven types of practice. And so it's very easy to transition to that. But what we see now are people who are not physicians. They really never practiced medicine in any way, shape, or form. A lot of people who have gone to nursing school and are able to obtain, um, a NP degree. And a lot of these programs are not really designed to train them specifically in anything like that, but they get an NP degree. And and this was done so nurses can serve in underserved areas. But what we're finding is, they're going to go into something that maybe a little bit more independent, a little bit more lucrative, profit driven. And so we see a lot of people who don't have maybe the right mindset, or the goals are really the training and the experience to be able to do this well and appropriately and safely. So the laws have changed to allow this to happen. And, but luckily, we're seeing a lot of patients who are now understanding the difference between going to somebody who's trained and somebody who's not. And they're going to make their decision. I would like to see, there would be more safety in medical spa practices, where if you are a nurse, that you have a physician who's supervising you, who's guiding you, who's teaching you, as opposed to them being completely independent in case there are complications, or again, just for learning and training experience. But it's not the case right now, but I'd love to see that happen.
Yeah, you're definitely not like a nail spa. Not that there's anything wrong with that, but I don't want someone who can do my nails doing other procedures on me.
Yeah,
you
hair
know.
salons, see a lot of that. Yep.
so what another thing, just because like I admire you very much, because you're a woman, I'm a woman and everything, but what challenges would you say, like being a woman in the medical field or just in general, have you found? Because, and then the follow-up question is just how do you empower women? But first, like what challenges have you come across for women in the industry or just in life or like in the community, trying to put, even in the 38th district, being an RDC. So it doesn't have to be med spa related, but just in general, what challenges have you come across? And then I can already know the answer. You've conquered them. So like how your words of encouragement to other women, to hit these types of challenges.
So, one, I would say if anybody, man or woman, wants to accomplish something, you can accomplish it. You get the idea, the motivation, and then you start doing, you start acting. And regardless of who is around you, there's probably always somebody who is going to challenge you. Um, we'll put it lightly. But, I have learned and worked in very male dominated fields, and from trauma surgery to the military, and definitely had their challenges. And I cannot say that that was specifically men who would say, were or gave me a hard time, but a lot of times other women as well. So I liken it to, it's really the individual person. If they're going to be a jerk in one aspect of their life, they're going to be a jerk in another. And you just have to just continue to, you know, just continue going on and doing what it is that you want to do and you accomplish. And don't worry so much about what other people think or say about you. Just do it anyway. So since then, I cannot say that I've encountered too much, based on being a woman, too much resistance. It could be that there is, and I'm just ignoring it. I think I've always just kind of ignored it. Um, but I think now, like, women absolutely, they're in all fields, everywhere. It's not as disparate as it maybe it once was. So, and men and women, we need to get along. So, we do. So,
And one of the reasons we met, both of our sons went to the same middle school and everything. Your son's a year behind, so he will be graduating soon and everything. So since I'm in that vein of thought right now, for graduates of high school, graduates of college, just in general, if somebody wants to go into pursue the medical profession or just in general, any career they feel passionate about, maybe the political spectrum. What kind of advice would you give them to meet their dreams? Like, if you were gonna, here's a good way of putting it: if you were going to give a commencement speech, what would be your pearls of wisdom?
well, one, is you can have one, you need imagination and creativity. You need to imagine, what it is you want your life to be like. Figure that out first. Don't go through life just like not knowing where you want to do or letting things happen to you. I would say have a clear cut vision, imagine it thoroughly, and then you got to get out of that, off your sofa and start acting. So start doing it. If you want to be in the medical field and you're a teenager, volunteer at a doctor's office. Plenty of doctors will let you do that. If you want to do, anything else in the political arena, we have teenagers who get involved in politics, and they will have mini elections and groups, and start doing it, and get involved in that. So whatever it might be, you want to be a vet, start taking care of animals, and see what it is you like about it. And then again, I'll say the same thing: be curious, learn as much as you can about it, top to bottom, in and out. Become like an expert to yourself. And if you can teach something to somebody else, you're teaching yourself. And that's the best way to learn something. Which is how medicine is. It's all about, we're teaching it, and the whole time that we're learning ourselves. And that's how you kind of get better, if you can explain something easily to somebody. So I think, that's it. Think of it and then start doing it.
Just do it.
Just do it.
And and I do believe that just to touch on, like if you were a lawyer, there's certain aspects and ways that you could give your services to the community. So for example, I'm in marketing, and I just feel like I can use my marketing assets, and I can give to the community. How would you suggest other medical professionals and everything, and it doesn't have to be to give back to the political community, but like just in general, to go beyond the 9 to 5 thing? What would you how would you say to other medical professionals they utilize their assets and use their power for good? Like, does that make sense?
Um, yeah. So let's see. As a specific medical professional, you have a choice. You can do, do you want to give back in something still in medicine, or do you want to give back something completely outside of medicine? And you can do both. So it could be like, you have a busy practice, but you really enjoy, hormone replacement therapy. And well, you just start doing that a little bit on the side. Just get involved, or do seminars or take classes, and then you can give back that way. But it doesn't have to be in your. And that is a good way of giving back. You're already an expert in something. Why not share more of that? But it could be, anything. You want to start. Um, helping people in our local homeless shelter. We have those. Do you want to, just get involved in that, or just start collecting clothing for children in our local area? So we have somebody who did that. And I guess, again, it's just find what your interests are, what your passion is, and go with it. It could be either one. It could be in your field or outside your field completely.
So it has been a pleasure having you on. I always like, because I'm like asking like a machine gun questions, but is there anything that you would like to share about anything? I'm just about promoting a positive message, or anything that you, pearls of wisdom, or anything you'd like to share with our audience that leave on a positive note.
I would just say, just for everybody to, we all live here together, and the more we can just be kind to each other, help each other, and that's really all we're here for. And to also to learn just in ourselves to be better people, and learn and grow, learn about ourselves, what makes us feel certain ways, and understand that other folks are going through their own thing, and not to pass judgment. So I would say that's it.
Well, if anyone's missed the scrolling thing, if you're local and you want to find out, she even has the zip codes and everything for the 38th, drcp.com. If you want to learn more about the 38th district, you can go there. If not, just Google your own community, get involved in everything. It is an election year, but just educate yourself, know what's going on. We do have a vote. We are in this country for a reason. We do have to get involved. And then renovemedspa.org is her website. She has specials all the time. You do not have to be in the Delaware area. I was surprised. Anyone who visits the beach, she has tons of New Yorkers in DC, Baltimore, and New Jersey. So come down to the beach. You know how much I like the beach and everything. And check out her website. Check out Renove Med Spa. Thank you so much for being here, and you definitely have lit a fire under my ass and got me involved, and I plan to be even more involved. And thank you for being here.
Well, thank you, Kristen. Appreciate it very much.